We are paging Dr. Paul. Dr. Paul joins us this morning to discuss the controversy surrounding the alleged link between Tylenol and autism. Good morning to you, Dr. Paul. This is perfect timing to have you in here this morning.
Yeah.
We got to talk about the controversy that Donald Trump made with the U.S. administration. What is the controversy with the link between acetaminophen and Tylenol and autism within pregnant women?
Okay. Well, first of all, there's no link. That's what I want to tell people. There's no link between acetaminophen, Tylenol products taken during pregnancy and autism in babies. So that's number one. The controversy, I'd call it rather a misinformation, is based on some studies that suggested sort of association between the two. New studies have shown, a new recent one on 2.5 million kids over 10 years of life, showed there's no correlation between Tylenol during pregnancy and autism, and we know that. The other thing that I think people should know is that autism has many causes, right? And the president and others saying, well, you know, we've got an epidemic of autism. It's not really that autism cases are increasing, we're diagnosing them more. We've widened the diagnosis, so it's a wider spectrum, so we're getting more cases. Now, that's not to say that autism is not important. Of course it's important, but there are multiple causes, and so we don't think that there's a link. So I think people out there who are asking the question, should I be taking Tylenol, or can I take Tylenol during pregnancy? The answer is yes, you can. However, I say a caveat as well. We tell all pregnant mothers, okay, that anytime they're pregnant, obviously, that they should limit medications, obviously, as much as possible. There are certain lists of medications they can take. One of them is Tylenol or acetaminophen, if needed, and following the prescription. So talk to your doctor and take it for a couple of days, and that's it. So doing that, millions of women have done that, and there's no consequences. So the bottom line is that I don't think you should be hesitant to do that. In fact, having fever and having other pain and those type of things during pregnancy, and you don't treat that, may actually lead more damage to the baby. It may cause premature birth, for example, if you have fever, or infection to the baby. So there are many reasons that we could take Tylenol. The other problem is that now that this message, which I believe is wrong, that's come out, mothers will say, well, I'm not going to take Tylenol. If I can't take Tylenol, I'll take something else. They may take something else that's more dangerous. The alternatives like Advil and the other things are not recommended during pregnancy, but we're fearing that they might just go to this because they've heard that. So it's misinformation. It's not really supported by any organization. Society of Obstetricians, Pediatric, everybody is saying that, European Union, everybody is saying that it is safe to take during pregnancy. Having said that, obviously we want to limit any medication you take during pregnancy, but if you need to take Tylenol, I don't think you should be afraid to do so.
Well, we really appreciate your time this morning, Dr. Paul, clearing this up, because there's been a lot of confusion amongst many, even just not pregnant women, but in general, to take Tylenol or not. So we really appreciate your time this morning giving us some clarification.
Thank you.